Now, North Carolina's stay-at-home order is now in effect, as we mentioned. Now we're learning more about how the state plans to track the impact of that flattening the curve of COVID-19 cases.
CBS 17's Capitol reporter Michael Hyland is live at the State Emergency Operations Center. And Michael, this is happening as the state's trying to preserve COVID-19 tests for those most at risk.
Right. We've been asking state health officials with these testing supply issues, how do they plan to track the spread of this and when do they expect the surge in hospitals? And tonight we're getting some of those answers. While you're told to stay at home, state health officials are looking at ways to stay on top of the spread of COVID-19. In a conference call, state epidemiologist Dr. Zach Moore put it like this.
I think the bad news, we have to acknowledge that we're just at the beginning.
He says in tracking the spread, looking at cases confirmed through testing will become increasingly unreliable. For example, the numbers won't factor in people with minor or no symptoms who don't get tested. So how will the state monitor this? Dr. Moore says the state will rely on a network of healthcare providers that report data on the number of patients with fever or respiratory illnesses, the number of emergency department visits, and deaths linked to COVID-19.
Recognizing that availability of testing and testing criteria are going to change, this gives us more of a stable set of specimens and a stable way of looking across the state.
I asked Dr. Moore when he expects North Carolina hospitals to see the surge of patients. He didn't give a clear answer, saying the state is still gathering data. The University of Washington has put out its own projections for North Carolina. Their model shows the peak happening on the 22nd of April with a shortage of 278 ICU beds. It also projects more than 1,700 deaths by summer when cases are projected to drop off. It assumes social distancing continues through the end of May. Robert Seligson is the CEO of the North Carolina Medical Society.
We don't exactly know at this moment. What we do know is that the way the cases load is right now in North Carolina, if we can flatten that curve and we can take care of the surge that could happen as a result of this virus, when that peak hits, we'll be prepared for it.
Experts say it could take 2 to 3 weeks to see the impacts of measures like the stay-at-home order. One positive thing that Dr. Moore pointed to is that North Carolina is seeing flu numbers drop off, so that way hospitals won't be dealing with a high number of flu patients at the same time they're trying to treat COVID-19 patients. Live in Raleigh, Michael Hyland, CBS 17 News.